In this video, we are going to talk about sleep apnea. Sleep apnea is characterized by multiple episodes of pauses in breathing during sleep. The sleep apnea generally is accepted to be present if the apnea-hyperapnea index is more than 15. It normally affects around 4% of the men and 2% of the women. The patients with obstructive sleep apnea may have comorbid conditions including excessive daytime sleepiness and an increased risk for hypertension, coronary artery disease, heart failure, and strokes. Sleep apnea can be divided into three types: obstructive, central, and mixed. The obstructive one is caused by transient episodic obstruction of the upper airway. There is absent or reduced airflow despite persistent respiratory effort. In case of the central, it is caused by transient episodic withdrawal of the CNS drive to breathe. There is no airflow because there is no respiratory effort. And the mixed one has a feature of both the OSA and the CSA. There are various risk factors for sleep apnea. For the obstructive one, the risk factors could be obesity, neuromuscular disease, alcohol or sedative use, nasal congestion, sleep deprivation, and neuromuscular disease. In case of the central, left ventricular failure, encephalopathy, myxedema, high altitude encephalitis could be the one. The signs and symptoms of sleep apnea could be excessive sleepiness, which is measured by using the Epworth Sleepiness Scale. More than 9 is considered abnormally sleepy. Additionally, loud snoring and apneic episodes recognized by the bed partner. Also, the patient himself or herself recognizes that one wakes up choking from time to time. Other are poor concentration, unrefreshing sleep, and walking unrefreshed, also nocturia. Other variable signs could be nocturnal sweating, reduced libido, and esophageal reflux. The investigation in case of sleep apnea is sleep study or polysomnography. Here the patients are monitored during sleep with electroencephalogram, flow monitor over the airway, pulse oximetry, and chest wall monitors, which detects the period of apnea or hypoapnea during sleep and determine the severity of apnea. The polysomnography evaluates sleep stages, airflow, ribcage movement, ECG, oxygen saturation, and limb movements. There are various treatments for sleep apnea. The conservative treatment is acceptable for patients with mild daytime symptoms. It consists of advocating that the patient sleep on their side rather than the back, lose their weight, and avoid using of the sedatives such as the benzodiazepine and alcohol. More severe cases often benefit from continuous positive airway pressure, known as CPAP, which involves the application of continuous positive pressure to the airways during sleep using a device which is a CPAP machine that delivers positive airway pressure through a face mask or a nasal pillow. This provides pneumatic splitting of the upper airways and prevent collapse and consequent obstruction and apnea. Polysomnography is usually performed with a patient fitted with CPAP in order to access the benefit of CPAP in reducing the AHI. Other treatment modalities may be used if CPAP is not tolerated or is ineffective. These consist of oral devices for mandibular or tongue repositioning during sleep and surgery such as uvulopalatopharyngoplasty, tonsillectomy, or tracheostomy. Tracheostomy is curable because it bypasses the airway obstruction. This is it for the video on sleep apnea. Please do like, subscribe our channel, and give your feedback. Thank you.